Are nasal mucus and phlegm the same substance? Due to a cold or allergic rhinitis, your nasal mucus starts to increase significantly and flows out of your nostrils. At this point, you quickly suck the mucus into your throat. Then you either swallow it or the mucus irritates your throat, making you want to cough it out. This can create a sensation of mucus and phlegm mixing together. Is phlegm just nasal mucus that is accumulated in the body for a long time? Actually, they still have differences. If we magnify the nasal mucosa, we will see that most areas are covered by a group of closely packed epithelial cells. Around these epithelial cells, there are two key players. One is the cilia that grow on top, and the other is the glands distributed around them. The daily task of these glands is to produce a bunch of mucus, which acts like a blanket covering the layer of cilia. This layer of mucus is what we commonly understand as nasal mucus or snot. It helps moisten the nasal cavity and also traps dust and bacteria that enter the nose from the outside, preventing them from entering the body. However, as you continue to breathe and more dirt comes in, a layer of mucus quickly becomes overwhelmed and needs to be replaced regularly. So, the cilia work hard to push the dirty mucus towards the nasal cavity, while the glands diligently secrete new mucus to replenish it. Under normal circumstances, we produce nearly 1,000 milliliters of nasal mucus every day. With the coordinated efforts of these key players, the cilia and glands, this mucus is pushed towards your throat at a rate of 5 millimeters per minute. Then, without you even noticing, it is swallowed along with other things. Thus, the cleaning work of the nasal cavity is completed. However, our stomachs end up consuming nasal mucus every day without us being aware of it. In our trachea and bronchi, there is also a group of ciliated cells and glands that produce mucus. They use the mucus to trap dirt and then expel it. However, unlike the nose, which can pass this dirt onto the stomach, the trachea cannot afford to pass it onto the lungs. Therefore, the cilia in this area can only clear the mucus outward, and this mucus is what we call phlegm. When the mucus is cleared from the bronchi all the way to the throat and reaches a certain amount, there are two options left. Either you can cough it out with the force of your cough, or if you haven't mastered this skill, you reluctantly swallow it. Under normal circumstances, our nose helps block most of the dirt, so our trachea doesn't need to produce as much mucus to clean the respiratory tract. It is only when there is an infection or inflammation in the trachea and lungs that a large amount of mucus is stimulated to be produced. This is when you will feel the presence of a significant amount of phlegm and the urge to cough it out, in addition to water and proteins. This phlegm contains a large number of immune cells that have fought and died, as well as dead and shedding epithelial cells, various pathogens, and so on. If you have difficulty coughing out such alarming phlegm, swallowing it into the stomach generally does not cause any harm. However, it is advisable for tuberculosis patients not to do so. Mycobacterium tuberculosis is an acid-fast bacterium that is rarely affected by stomach acid, and swallowing phlegm containing these bacteria can lead to intestinal tuberculosis.